It's good to be with you this morning. And for those of you that might know my name, you probably realize that I'm a neurosurgeon. And you might wonder why I'm talking about Alzheimer's disease and brain health. Well, as the chairman of the Norton Neuroscience Institute, we looked at the overall institute about 2 years ago and wondered what is it that we're lacking in the Norton Neuroscience Institute. And I realized that the area of dementia and memory and cognition was not being addressed completely in the center. So I went around to try to find someone that could really represent us, a neurologist that could represent us in that area, and couldn't find anyone. So what often happens is that you do it yourself. And so we started this, and over the last 2 years, we've put together just an amazing team. And you've met Dr. Greg Cooper in the past, who's spoken to this group, and Dr. Rachel Hart, a geriatrician, is part of the group, and it continues to expand. There are probably 15 to 20 people in our Alzheimer's dementia group right now. But I would like to talk to you today about certain aspects of brain health and how closely that affects people that have memory loss, dementia, and cognitive problems. When one thinks of lifespan, lifespan is just the duration of life that one lives. And it's, if you live from birth till 80 years old, then that's your lifespan. Health span, on the other hand, is somewhat more important. It's a situation that measures the duration of time that people live in the healthy state. And I don't think many of us would argue that it's much more important to live a long, healthy life in a healthy state and then die quickly after that than living a long lifespan of maybe 80 or 90 years and then being sick for the last 20 or 30 years of their life. And so we're going to address that issue and look at the quality of life, which is made up of three major factors: the physical health of the patient, the cognition of the patient, that is their memory, their ability to think, and the mental health or emotional health. There are only about 20% of people that die from cardiopulmonary death. That is, that die from accidents or live to a ripe old age in perfect condition and then die very quickly after that. Cardiopulmonary death is what we have the physicians sign on the death certificate. They died of a heart attack, they died of pneumonia, they died of an auto accident. But unfortunately, 80% of people die from a different death. While they're still in this world, they often have a cognitive death. These are people that, unfortunately, whose memory begins to fail them. They can't articulate, they can't plan ahead, they lose their ability to be part of the world community. And that's a very sad situation. And in that, we have patients that have mild cognitive impairment, and ultimately that leads to dementia and often Alzheimer's disease, and many of the other types of dementia associated with Alzheimer's disease. The physical health is also important because so often we see people as they get older, they lose their general health. They develop osteoporosis with multiple fractures in the legs and arms and spine. And they develop something that the physicians call sarcopenia, or a loss of muscle bulk. The muscles that are so strong and healthy and vibrant early in life become very thin, atrophic, and shrunken. And that's sarcopenia. And it causes people not to be able to maintain their balance, and they tend to fall. Or they may have problems with emotional health that goes on for years and years. And by that, I'm not talking just about the problems that have major psychiatric disease, such as manic depressive or bipolar disorder or schizophrenia, but patients that are unable to cope with activities in everyday life. Loss of a child, loss of a spouse, divorce, people losing their jobs or becoming financially insolvent. These are people that just simply cannot deal with those emotional stresses during life. So they die a very painful, slow death before they actually die of cardiopulmonary death. The medical profession has not done a very good job over the years in addressing people for these types of problems. We're taught in medical school to deal with diseases. When people come into the office with a specific disease, whether it be the heart or the lungs or GI tract, we know how to treat those conditions, and we've done a remarkable job in doing that. The lifespan of people over the last 120 years has been truly remarkable because of the advances being made by the medical profession. In 1900, the average survival was 47 years of age. And today, it's somewhere in the order of 80 years of age. So what's caused this improvement? Largely through the science of medicine. Well, there's been treatment of childhood diseases. The death rate at birth has decreased significantly. There's been the advent of antibiotics, treatment of hypertension, people getting anticoagulant therapy, and even the avant-garde, the transplantation, and other new miracles of medicine have tended to increase its lifespan over the last 120 years. But we've done little to improve the physical, the mental, and the cognitive, and the emotional, excuse me, state of patients that have major problems. And it's to that end that I'm going to be talking to you today. How do we change that? There are three major causes of death that constitute the cause of death in about 75% of patients, 75, 80%. The first and most important one of these is atherosclerosis, or hardening of the arteries and blockage of blood vessels. When a blood vessel going to the heart is blocked, it's a myocardial infarction, a heart attack. When a blood vessel going to the brain is blocked, it causes a stroke. The next major cause of death is cancer, from many causes, and there have been great inroads made in the treatment of cancer over the years. When I started to practice many years ago, leukemia was really a death sentence, but now many leukemias are treated and people live a normal lifespan with the chemotherapeutic agents. On the other hand, certain brain tumors, such as a glioblastoma multiforme, we've made little progress in longevity and survival over the last 100 years. And finally, the third major cause of death is the neurodegeneration. Alzheimer's disease, Parkinson's disease. These are really very similar diseases. What differs is what part of the brain is affected by loss of brain cells. In Alzheimer's, there's loss of the brain cells in the area called the hippocampus and the entorhinal cortex, which gradually spreads throughout the whole body or through the whole brain. Parkinson's disease is loss of the brain cells in an area called the substantia nigra and the thalamus. So what's common with all these diseases? Well, the thing that's common is type 2 diabetes. And type 2 diabetes is probably poorly named because it makes us think of diabetes, which is type 1 diabetes. And type 1 diabetes is simply the loss of production of insulin by the pancreas in childhood. And so there's just not enough insulin produced to maintain adequate function of glucose utilization in the body. Type 2 diabetes is something that occurs later in life. And it's a constellation of symptoms. It's a group of conditions. And I've listed those here, where there's high blood sugar. You may get high insulin as a result of the high blood sugar, insulin resistance, or this NAFDL, non-alcoholic fatty liver disease. And for years and years, pathologists, when they looked at the liver of people that had died, saw that fatty liver was associated with alcoholism, people that drank heavily, used to get fatty liver, and it was thought that it was purely a disease of alcoholics. However, as time went on, it was recognized that many people had livers that were identical to the alcoholic disease, but had no history of drinking alcohol. It became aware that the common feature in those patients was that they virtually all had type 2 diabetes. And so this became a hallmark, one of the major hallmarks and part of the syndrome of type 2 diabetes, that is non-alcoholic fatty liver disease. And this type 2 diabetes affects an enormous number of people. I mean, over 50%, almost 60% of the population in the United States have this disease. So this is a spectrum, and the diagnosis of type 2 diabetes is made by doing a blood test, hemoglobin A1C. And when that measure is greater than 6.5%, that is 6.5% of the blood cells in the body are loaded with glucose. That's the diagnosis of diabetes or type 2 diabetes is made. It should be less than 6.5%, but if it's over 6.5%, then the diagnosis of this condition is made. And 6.5% is equivalent to a blood sugar of about 140 deciliter percent. This is what happens. And the culprit is this, we'll talk at great length about this. It's the food with excess of carbohydrates, the breads, the pastas, the potatoes, rice. These are the mainstay of most people's diets in the United States, but they're also the culprit to this type 2 diabetes occurring. Even more important are the fast sugars, the soft drinks, cookies, cakes. The fast foods from restaurants are loaded with fast sugars. And so this is what we'll try to prove to you today is really the primary cause of type 2 diabetes. And we'll talk about some of the ways to try to reverse that condition to decrease not only the incidence of type 2 diabetes, but to decrease the incidence of obesity, which is part and parcel, part of type 2 diabetes. Well, when patients and people eat these carbohydrates, they get a high sugar level in the blood, stimulates the insulin level that reaches a peak, and the insulin programs the glucose to be taken up in the fat cells, in muscles, and in the liver. And that's really the function of insulin, is to stimulate the uptake of the cells of glucose. Several hours after the blood sugar drops back down again, then the fat cells and the muscles and the liver can't release enough glucose into the bloodstream. So the patients feel hungry and fatigued as they eat again. And so that whole vicious cycle is repeated day in and day out, day in and day out over the course of the life of the patients. So how do we reverse or cure or cause type 2 diabetes to go in remission? Well, part of the problem is we have to consider how much glucose, how much of these fast sugars and starches we're taking in. And it's commonly said, well, people eat too much and they don't exercise enough. Well, both of those statements are probably wrong. It's not a question of just how much glucose we're taking in or how many calories we're taking in. When in England many years ago, people looked at the types of calories that were taken in, and if one is obese and they're put on a severe weight restriction diet, normally people utilize about 2,200 calories per day. Women use about 2,000 calories per day, and men need about 2,500 calories per day. But the average utilization is about 2,200 calories per day. If we put patients on a diet of 800 to 1,000 calories per day, over the year, they'll only lose 11 pounds. Not very impressive. Their diet otherwise is kept the very same, but they've just decreased the amount they're eating to 800 to 1,000 calories per day. They lose only 11 pounds over a year, which they quickly put on in the next year. So there's something wrong with just the amount of glucose we're taking. If we look at how much we eat, we can caloric restrict people. And it's shown that in animals, that caloric restriction alone can increase the lifespan. It can decrease the type 2 diabetes in genetically produced mice. But in humans, that alone, the caloric restriction, is not adequate to help lose weight. It's an inadequate way to treat them. When you eat, well, the time restriction may be somewhat important as well. And we've all heard about the various diets. You know, the don't eat for 18 hours, restrict all your food to 8 hours or to 6 hours. Well, that can be some help, but alone, that's not too helpful either. What is important is the quality of what is eaten. And the importance is not to eat the starches and the sugars, but to eat more of the fatty and the protein foods. A study was done many years ago in which the caloric intake was different in 3 groups of patients. In the one group, there was a very high carbohydrate caloric intake. 90% of the calories taken in per day was in the form of carbohydrates. In the second group of patients, 90% of the calories were taken in as protein. And in the third group of patients, 90% of the calories were taken in as fats. Well, you might guess, well, who lost the most weight over a course of a year? Well, the patients that had the 90% calories of fat were the ones that lost the most weight. Next to that was the group that ate the 90% of proteins. And those that ate 90% carbohydrates didn't lose weight. In fact, they gained weight. So it really comes down as to what the person is eating, not just the quantity, but the quality. So there's no upside to sugar. 99% down sugar. And many people have called the sugar intake the mass murder through the creation of type 2 diabetes and the various complications that can occur from that. So that was the problem with intake. The next problem is the output side. And even though it's important to get exercise to maintain muscle mass and to maintain cardiovascular fitness and to maintain the general health and well-being and the psychological well-being of performing exercise, it's not a good way to lose weight. People have tried to lose weight by exercise alone and diet alone. They've been unsuccessful. So it's not that people don't have the willpower, they simply are not doing the right thing. One thing that's important, and we don't really address this, but it is the sleep deprivation, which turns out to be one of the most important aspects of patients that are trying to lose weight. If you take, and one study did this, 20 men, healthy men in their 20s and 30s, and you sleep deprive them over a course of 2 weeks of sleeping only 4 hours per night. They stayed on the same diet they'd always been on before. They were otherwise the very same, except they were kept awake for 20 hours a day and allowed to sleep only 4 hours a night. Shockingly, these patients all became diabetic. So the sleep deprivation alone was enough to convert men that had been totally normal beforehand into diabetics in that constellation of symptoms of the hyperinsulinemia, the hyperglycemia, but they all became diabetic. It's an amazing finding. So sleep deprivation, the 7.5 to 8.5 hours per night, may be a very important part, along with the diet, of being able to lose weight. And that's a big lifestyle change for a lot of people. A lot of people go on the diets, the Atkins diet, and any number of diets that we can think of. They say, well, I just can't lose weight. I've been doing this, I've followed the diet Well, they're not at fault. The fault is the diet. The plan is not right. So if you follow two major things, three things, is to start eating the right quality food, to start doing some exercise. And the exercise can be really quite simple, of walking for half an hour a day for 5 days a week. That's adequate exercise to start doing much better, and getting adequate sleep. The stress certainly is an important part of this, because stress has the effect of making people feel hungry. But that itself is not as important as the other factors in causing the remission. So we'll deal with a couple of problems that we have. Homeostasis and hormesis. We'll just pass on the homeostasis, but it's an attempt of the body to maintain physiological stability. But as people get older, in their 30s and their 40s, they get older, and they become less tolerant, and become resistant to temperature, and they can't tolerate stress, and they can't eat as much food as they did when they were youngster. They can't eat the amount of glucose they had. So the homeostasis decreases people age. So the simple act of aging makes people lose their homeostasis. And even though you may be eating the same number of calories that you ate when you were 20 years old, when you were 20, you could use up those calories. Your body was capable of acting to it. But as you get older, the same number of calories, the same diet will result in that gradual gain of weight, 2 pounds a year, until 40 years later, you're 80 pounds heavier than you were at 20 years of age. Hormesis, on the other hand, is a process whereby mild damage or toxicity to the body can bring about healthy effects, because it activates repair and protection. And I'll talk at some length about hormesis, but we'll not get to that yet. So what is the purpose of training? Why do you train yourself to do these things? Why do you do exercise? Well, to maintain stability. If you walk and you haven't trained to maintain balance and coordination, then you're going to be unsteady. You're going to fall. And if you have sarcopenia and osteoporosis, you're going to fracture hips and legs or spine. It's also for the purpose of maintaining strength. The weights, the small weights, even 3 to 5 pound weights, are important for the upper extremities, and walking on a regular basis. I remember a good friend of mine, Dr. Condit Moore, who's many of you may know, was a surgical oncologist many years ago, and he retired, and I saw him when he was 95 years of age, and he was as bright, as alert as could be. And I said, Condit, what is the secret to you being able to do this? And he spoke about the sleep, and he spoke about the proper diet, quality food. One thing he said that really impressed me was that he was taking ballet lessons. He was taking ballet lessons to allow him to maintain the stability, standing on one foot for a longer period of time, walking heel to toe, performing the moves that ballet instructors had them learn. So it sounds almost counterintuitive that ballet dancing could help him, but it wasn't that he was dancing, but he was learning the moves. He was learning the stability that ballet dancers are so proficient in performing. So the walking 30 minutes a day, 5 days per week. And as we get older, that may be all we can do physically. But the best form of physical training is HIIT, a high intensity interval training. If you have a treadmill or an elliptical at home, and the idea of high intensity intermittent interval training is that you push it very, very hard for a minute. You really go to it, you pump hard on your elliptical for a minute, up to 80, 90% of maximum intensity, then you stop. You relax for a minute to gain your breath. Then a minute later, you start up again and do the highest intensity you can for another minute, then stop. You may only be able to do this 3 or 4 times when you first begin. But over the course of months of training, you can increase this to 10 minutes vigorous training to 10 minutes off. And that's the high intensity interval training. So don't let it be said that I told you to go and do that. If you've not done that kind of training, you really should check with your physician to be sure that your heart is going to be able to tolerate it and your lungs can tolerate it. If you've not done that kind of training over a course of a long time, be careful doing that. But it really is the best kind of training that you can do. And don't be in competition, not only in competition with other people, but even with yourself. As people get older, you don't have to worry about competing with your best time or having to produce your best time. That's not important. You're out there to maintain balance, coordination, cardiovascular fitness, and really a purpose of life. We talk about all of these things as being part of what we have when people develop memory problems in their 60s and 70s, when people's memories start to decline and they develop cognitive problems of mild cognitive impairment and ultimately the early stages of dementia. And we think of dementia and Alzheimer's disease as a disease of the elderly. It's not a disease of the elderly at all. It's a disease of middle age. This disease starts in the 30s and the 40s. And it starts from lifestyle patterns that occur at that age. People that have hypertension that don't control their blood pressure well, or diabetes that are poorly controlled, who eat too much or overweight, who smoke, who don't sleep well at night. This is the time in the 30s and 40s where the changes of amyloid plaques and the begin to develop in Alzheimer's disease. And it accumulates so that only the effect of those changes that have occurred over the last 20 or 30 years are seen later in life. Now, some people may argue and say, well, I always exercised throughout my whole life and I ate well, I wasn't heavy, and I still developed Alzheimer's disease when I was 75 or 80. Well, yes, it can still happen to people that do all the proper things, but it might have happened. You might have developed Alzheimer's or cognitive problems 5 to 10 years earlier had you not done those things. So that even though we may not be able to cure Alzheimer's disease at this time, we need to do what we can do to prolong it, to delay its development. And that's what we're doing by the points I'm making here today. Within the next year, we'll be starting a program in our Alzheimer's group in which we'll be addressing those patients and people in their 30s and 40s who are high risk and talking to them about how they can manage their life and change their lifestyle to delay or postpone or prevent developing Alzheimer's disease. So here's some of the diet, and you all know this diet. You've read about this, but knowing, unfortunately, is not doing. And to go from that knowledge base to the action is very, very difficult. But let's start at the bottom of this hourglass slide. What's the most important? Well, water, green tea, the plant-based milk, coffee. These are the mainstay. These are the most important things. But then oatmeal, legumes, vegetables, very important, mushrooms, fruit, limited amount of fruit because there's often a lot of sugar in the form of glucose in sugar or in the fruits. Then the fatty fish, poultry, eggs, cheese are good. Dark chocolate, nuts, soy yogurt, naturals, not sugar, but natural sweeteners. And then the dietary supplements, the medications that we'll talk about a bit later on. But then you get into the area of eating less. And this is the standard Western diet. This is the diet that people have that create type 2 diabetes. And so many people can relate to this because this is what they eat. This is their diet. Margarine, butter, fatty sauces, salt and sugar, sweet foods, cookies, cake, candies, Just think of this. These are the kind of things that people eat all the time: fast foods, red meat, beef and pork. Ultimately, getting to the worst things you can do is bread, potatoes, pasta, and rice. And finally, yogurt. And yogurt in general is good if it's soy yogurt, but the sugar added to the yogurt is a problem in many yogurts that are sold commercially. Soft drinks. So this is a diet that many of you may be on now, but to change from type 2 diabetes to a normal with a hemoglobin A1C of less than 6.5, it's important to institute these kind of changes. And not only will you hopefully reverse the effects of type 2 diabetes, but you'll lose weight, delay the onset of dementia and cancer and hypertension leading to stroke. That's the purpose of what we're trying to do with these dietary, exercise, sleep changes. This slide shows the importance of emotional coping mechanisms. And this is really a very major, important part, because people simply have troubles living. They're depressed, they're anxious, they have trouble coping with problems in life. And the bottom area here shows adequate coping mechanisms. But then they have stresses through their life, and the stresses can vary in their intensity. And if one has a wide emotional buffer resilience space here, as shown in the yellow, then they can tolerate this stress, that stress, this stress, but this stress is just too much for them. They can't bear it, and they get to an emotional breaking point. And this is similar to temperatures. If somebody's temperature buffer ranges from 97 to 105, they're very fortunate, because if people get over 105 degrees temperature, they often have a seizure, an epileptic seizure. And so that wide resistance, or that wide temperature area is very important. They can tolerate the increased temperature to 100, 102 and not have any severe side effects from it. On the other hand, if that buffer is narrowed, if you're just made with, you're born with, your philosophy in life, your mental aspect, your outlook in life is a narrower emotional buffer, then each one of these stresses in life will result in an emotional breaking point, except this one. And it's the same with the temperature people have. If they have a small temperature buffer of 97 to 99, they reach a temperature of 100 to 101, they're more likely to have an epileptic seizure. So it's this kind of emotional resistance. And there are many ways to increase one's emotional resistance. Reading, listening to motivational tapes. There's so many things on YouTube now that are ways that you can increase your emotional resistance here. And as difficult as life is, it's life, and that's what we're stuck with. And it's important to try to increase that emotional buffer. Well, why do we study aging? Well, because aging is the common denominator of all these diseases. People that have heart attacks, stroke, or cancer, or dementia, people will all develop this if they live long enough. So aging is a multi-factor disease, that it's inherited in everyone, and the outcome in every person with aging is fatal. So it may affect one organ more than the others, and it may be that your heart is the organ that will be most severely and most early treated by aging, but sooner or later, all the organs are affected by aging. So what are some of the specifics that we can do? I've spoken about the importance of exercise and all these things, but let's look at some of the specific steps that we can do to talk about these things and try to avoid the aging process. Well, the first group are avoiding deficiencies. And this is the role of vitamins and mineral supplements. That doesn't get rid of the importance of eating healthy things such as the vegetables and the various things I've spoken about earlier. But some of the supplements, the multivitamins, are just not adequate because many of the vitamins and the minerals in these are just at too low levels. For example, magnesium, an important mineral in your body, is very often only 80 milligrams in the multivitamins, but the human needs about 300 to 600. So if they're not eating a very healthy meal, they certainly won't gain adequate number of magnesium or adequate level of magnesium by the multivitamin pill itself. The same with potassium, only 50 milligrams in many multivitamins. You need 5,400 milligrams per day. Obviously, that has to come from food. And if that food is poorly absorbed by the body, magnesium, for example, magnesium malate is absorbed well, but magnesium oxide is not. So you should look to see if you're taking the right kind of magnesium, if you're taking that as an additive supplement. Zinc is very important, not only for the importance of preventing infection, but for bone structure and many cell metabolic structures that are dependent on that. Vitamin E, be careful about that because very often only one form of vitamin E, where several forms are needed. And vitamin B is often not present at adequate levels. So it's good to take an extra vitamin B supplement because B6, B12, and B12 and B9 are important. They're not adequate in the multivitamins. There are foods that are very important in providing these deficiencies. And selenium, for example, is very high in Brazil nuts and seafood. Vitamin D3 is important because it's necessary for the prevention of osteoporosis or other diseases such as that. You can gain from the supplements, but a supplement of over 2,000 units per day is important. Sunlight is also a good way to get vitamin D, but that varies and does age the skin. Vitamin K works together with vitamin D, important for osteoporosis, and decreases the calcification in blood vessels. Vitamin K1, important in plants, in spinach, Brussels sprouts, and herbs, and K2 in cheese. Potassium, we've spoken about the importance of not getting enough potassium in the vitamin pills, the multivitamin, but increased in these vegetables and fruits. Iodine, same thing. And a varied health diet is very important. The vegetables, the nuts, the seeds, the legumes, the fish, poultry, dark chocolate, very important. Don't overdo it and don't eat the chocolate with high milk content in it, but the dark chocolate, 72% chocolate or higher, is recommended as being the healthy type. So those are some of the deficiencies that you can avoid. So now we come to the hormesis that I've alluded to earlier on. It's a process whereby mild damage or toxicity can bring about healthy benefits. These are toxic substances that are presented to the body. And you think, well, toxic substances are bad. Well, not when they're given in small doses. It's very interesting that metformin, a commonly used drug for diabetes, is a toxic substance. It was first described by Dutch sheep farmers, in which the sheep died because they were eating excessive amounts of a plant which had high metformin levels in it. So you give metformin to stress the mitochondria in the body. And as it stresses it, it makes it more productive. So you're producing mild damage to the body, to the mitochondria, or you're creating toxicity to the body, and that's good. Think of it as an athlete training to be in a competitive episode, a competitive event. They train hard, they work hard, they push themselves to the extreme, but stop before they break. Their muscles are damaged. They have to rest for a day to allow those muscles to repair themselves. But the next day they go through that process again, pushing it a little bit further. And over the course of weeks or months, they become superb athletes. Well, this is what we're talking about with hormesis. We're talking about stressing the body with these substances, these foods, these metformin. And metformin is a very interesting drug because it's the one drug that many people that are studying longevity will take prophylactically. They don't have diabetes, type 2 diabetes, but there's word in the animal research laboratories that metformin actually greatly increases the lifespan. Well, even if it can increase it for a couple of years, many of these scientists are taking metformin 750 milligrams a day or 500 milligrams twice a day as part of their routine diet and their general life. I've spoken before about the high intensity interval training as a form of hormesis. You stress the body, push them for a minute, rest, push them for a minute. Maybe that radioactivity, there's some islands in the Mediterranean that have high radioactivity, and the survival, the lifespan is much greater in those patients. Temperature for heat and cold, especially cold, may be very important as far as creating hormesis and increasing this. But there are many foods that have hormetic properties. Green tea is a stressful, mildly toxic substance, as is coffee and vegetables and dark chocolate. These are all hormetic foods that we've recommended are important to decrease weight because of the proper quality. But the way they do this is through the process of hormesis. Even though we talk about the high interval intensive training affecting the muscles, it doesn't only affect the muscles, but it affects the heart. It certainly affects the muscles of the arms and legs, but it has a halo effect on other parts of the body. It increases one's function of the brain by producing a BDNRA. It's a substance which produces new brain cells. So it has a positive effect on the brain. Is it a positive effect on the cognition? Positive effect on people's emotions. So even though we think of exercise as being important for the muscles of the body, it has a much broader reason to be performing it than just for the muscles. Middle-aged people who began exercise walking a half hour per day, twice a week, had 62% lower risk of getting Alzheimer's disease. In another study, even the older patients, late middle-aged to older patients, 40 minutes, 3 times a week, after 1 year, they looked at their brains by MRI scans and seen that the part of the brain that is associated with Alzheimer's disease, the hippocampus, which in Alzheimer's disease shrinks up, had increased its volume. So here you have physical activity affecting brain structure. Really quite amazing. And here are some of the foods. We'll talk about the coffee or a piece of broccoli or Brussels sprouts. These are important, mildly toxic drugs, foods to increase one's hormetic process. Spoken about most of the cacao ingredient in chocolate, at least 70% of cacao content. Blueberries, you hear people saying, well, eat your blueberries 3 times a week. Well, it certainly has not only an antioxidant effect, which is not the real effect of blueberries, but increases hormesis, which probably is the important problem. This is a slide that shows what happens to people from a standpoint of longevity and health in people that are on a number of vegetables per day. And if they are up to 3 vegetables today, the survival is 14% greater. And each one of these has a greater effect with increased glucose, or increased vegetables and nuts and legumes. Very important. We've spoken about this major. So we'll look briefly now at how do you reduce growth stimulation. We've stimulated the hormesis, we've avoided the deficiencies, but now we're going to look at how to reduce growth stimulation. Well, there are certain hormones produced by the body under normal circumstances. We've spoken about insulin, but insulin-like growth factor, growth hormone, testosterone, and glucose can all stimulate the cells to grow, to get larger. Certainly, you know of the testosterone effect in men. A poor use of testosterone is in pills where the muscle mass is increased, but the testosterone has other bad effects. Using the Western diet, these switches, these hormones are increased. There's increased insulin to produce hyperinsulinemia and type 2 diabetes. Growth hormone stimulates the body. It makes the muscles larger, but it also increases the metabolic rate. And it's continuously activated by an excess of unhealthy foods. So if you consume foods with fast sugar and amino acids from animal proteins and unhealthy fats that activate these growth switches, it'll make us gain weight and make our body age faster. The best diet for losing weight also slows down aging and slows down the development of dementia and memory problems and improves brain health. You hear about fructose and glucose. Well, glucose is a molecule, that's a pure sugar molecule, and fructose is another molecule. Both are unhealthy, but particularly fructose. These two sugars come together and they produce sucrose, and sucrose is what you have mostly around the house. Fructose is worse than glucose because fructose, when it's metabolized, cannot be taken up by the muscle. It can only be taken up by the liver. And the glucose, on the other hand, can be taken up by the entire body. So fructose causes a greater accumulation of fat in the liver. This is what causes people to develop a pot belly. Man, you see them have this, and they've had really just too much fructose. And it's such an insidious sugar because it's in almost everything we eat. You have to look for it and consciously and assiduously avoid eating fructose. It causes insulin resistance, and doing some bad things is cross-linking with faster. Glycosation of glucose is important. So another way to decrease growth stimulation is to look at the microbiome and the composition of bacteria in the gut. There are 100 times or 10 times as many cells in your GI tract, that is the bacteria, as there are the entire number of cells in our body. And in the past, this has been largely unappreciated as to the importance of gaining weight. But the type of food that you eat would change the bacterial content. It changes the bacterial flora. It changes the microbiome of the GI tract. And the microbiome alteration will change people's behavior, change their emotional state, so that it's this intermediary of the bacteria in the GI tract, which really is what affects the way that the food is consumed, and it changes the way people's behavior is. You hear about children that are very poorly behaved in school, and they're poorly behaved in school because it turns out that they're on a high sugar diet, eating fast foods, eating a lot of sugar, and their diet is changed, and they become model students. So it changes behavior in children, it changes behavior as people get older. And this microbiome is very important. And you hear about the probiotics, and there are a great number of sales made by probiotics. And the concern about those is that you really are never sure what the true bacterial content in those probiotics are. Are you getting a viable probiotic that has a high content? Some of these are 60 billion bacteria or probiotic substances, or 90 billion, but you don't know what you're really getting. And that's the concern, that even though they may be of some value, they may not be truly soul of what they're saying. We're now doing a study on the microbiome study with Shirish Barva at the University of Louisville, looking at the microbiome study of patients that have minor cognitive disorder and dementia, and seeing if that microbiome really is a predictor of dementia. And we're looking at ways that we may be able to change the microbiome structure in patients to delay, postpone, or even prevent the development of dementia. So there's a new story, a long story that we're just starting to scratch the surface of the microbiome. Shirish, who's Dr. Barva, who's a member, advocates the use of kefir as a very important way to increase the good bacterial content in the body. So all of us had heard him talk. We all started taking kefir. And so we reported the next week of how our experience was with kefir. He said, no, you're all taking this wrong because you're taking it with sugar. And if you look at the kefirs in the grocery store, you'll see that most are associated with sugars. You have to get the type that has no sugar added. Doesn't taste very good, but you can develop a tolerance to the taste of kefir. Very interesting study was done here in a fat mouse. If you sew together part of the body of a fat mouse to a thin mouse, then the thin mouse will become fatter because there are substances in the bloodstream that are carried from the fat mouse to the thin mouse, which will make him thin and start eating more and just eating it. So there's something in the bloodstream, and it may just be the insulin and insulin-like growth factors, et cetera, that do that. Now, I marked this in red because it's so important. David Ludwig, who's at the University of California at San Francisco, has made a statement that really holds very true, that the food industry would love to explain that obesity and type 2 diabetes is a problem of personal responsibility, that the person just didn't have the willpower to stop eating as much as they should and to exercise as much as they should, because it takes the onus, takes the responsibility off the food industry for them marketing fast foods and soft drinks and other high calorie, low quality products. So I would say that it's not really a person that's obese's fault. It's really largely a fault of the food industry that has marketed very, very heavily. They've affected legislation that goes through that might reflect poorly on them. So they keep producing the fast foods. They keep producing the soft drinks. And there's nothing much more addictive than Mountain Dew and Coca-Cola. People get addicted to these drinks and other high quality. You can just think of, how do you put down a bag of potato chips? Very difficult to do. And so their food industry has chemists, food chemists, who really have learned how to mix fat and salt and sugar together to make it palatable so that it affects your brain, your centers in the brain that are stimulated to want to eat. And it's very interesting. If you look at MRI scans, specific kind of scan, a functional MRI scan of a patient that is obese, and you'll see that when they're thinking of food that are overweight, their center in the brainstem triggers off. And so you see increased activity in the brains of these people that are obese. The fascinating part about that is that when you put somebody who is addicted to heroin or morphine or cocaine in the MRI scan and do that functional MRI scan, they show an identical picture to patients that have obesity who are addicted to sugar. So the addiction to sugar is very similar, fortunately more socially acceptable, but very similar in its effect on the brain as the stimulation of sugars. The food industry really promotes the addiction to sugar and to food. They love sugar, salt, and fat. So how do you reduce the growth stimulation? That was that third goal that we had. Well, the bottom line is to consume fewer fast and starchy food. We've spoken about that. Eating less meat and replacing animal proteins with vegetable proteins. We've spoken at length about that. Primary plant-based. We've spoken in detail about that. And much fiber, fats, and sour food. People talk about the vinegar diet. Well, that's a good way to produce hormesis, not necessarily the most palatable, but certainly important because it produces hormesis. It stresses the body, as does lemon juice. And that's the basis for their promoting weight loss. And stop eating when you're 80% full. That partly is our attempt to control things. You don't have to eat everything that's in front of you. Eat only what you feel up to the point that you're 80% full. Well, I'll just say a word about the reverse aging, and I won't get into this at all because these are areas that we don't have available to us. There's a lot of work being done now, but none of these are really in active clinical service at this time. We've spoken about the things that we can do, but these are things undergoing major research at this time. But it's the vaccine toward aging. So if you can take a vaccine that allows you to live longer and promote not just living longer, but promoting a healthy lifespan, very important. Lysosomes are substances in the cells that take up the fat substances. So you do that, the enzyme therapy, and they become less effective as people age. So we're talking about enzymes that get given to the body to stimulate the lysosomes. Cross-link breakers, cross-link between sugars and proteins are part of what increases the aging process. And moving mitochondria from moving mitochondrial genes to the nucleus of the cell, which is much safer. Stem cells are also being used in CRISPR proteins by actually changing the structure of the genes in the body, changing the structure, then replacing those altered genes back into the body to help people become older and giving old mice new blood. And that's what we have here. So, ladies and gentlemen, that's all I have to say today. And goodness, it's 11 o'clock. I couldn't have planned that better.
Thank you, Dr. Shields. We do have several questions in the question box. If you go to the top of your screen where it says Q&A, you'll be able to see those.
All right. Let me start at the top here. What are your thoughts on ghee? Oh, great. Thanks for asking about ghee. I did not mention it, but ghee as an alternative of butter is very good. Butter is better than it used to be thought. Years and years ago, butter was the culprit during that age that fats were the poison and carbohydrates were good. Butters were, really a bad thing to eat. And so that's when the margarine came in. But butters had a little bit of a resurgence that the full fats, saturated fats are not as bad a player as they used to be, but they still aren't the best. But the ghee is very important, and I would certainly advocate that being used. And for that matter, the virgin olive oil is also very important to use. Instead of putting butter in your bread, just dip it in virgin olive oil. Girish Caldwell. Is that Dr. Caldwell I'm seeing here or not?
It is, Doctor.
It is, Doctor. Oh, hi, Grace. How are you doing? Thanks for stressing the importance of diet and exercise in ensuring better brain health. Are there any studies showing that slowing Alzheimer's disease progression can be achieved by a healthy lifestyle, as you've articulated? Grace, it depends on how far the Alzheimer's has progressed. There are many books out, and it's anecdotal in the books. And if you look at a book called The End of Alzheimer's, I've forgotten the doctor's name. It's from California. He has his own center up there. And he has many exciting examples of people that have had to quit work, CEOs of businesses and executives who have had to quit work because of the diagnosis of Alzheimer's being placed on them. And they've gone through this program of his, which is very similar. He gets into looking at the toxins, the bad things, of which there are many. And he is documenting many of those patients who were diagnosed as having Alzheimer's. And of course, once you're diagnosed as Alzheimer's, the families and everybody think, well, it's game over, things are over, but there are things to be done. So yes, I think there is hope for patients that have early diagnosis of Alzheimer's disease in getting back. It certainly can delay the progression. Now, Rich, we had a discussion a couple of years ago, and it had to do with what is the role of genetics in creating these neurodegenerative disorder, and what is the role of environment? Well, we used to think that genetics had a big part to play, but it now appears that even though genetics have some role to play, it probably only has about a 20% effect to play in the development of Alzheimer's. What's most important, accounts for the 80%, is the environment. What you eat, how you sleep, how you exercise, the things that we've spoken about in this talk. So that's the 80%. So yes, some people are born with bad genes and you can't choose your parents again. You're just born with that, and that's the way it is. But as part of the 80%, it's really very, very important to be cognizant of that. It's interesting that if one looks at the patients that come in, they all want to have genetic testing done. And that most people, our geriatricians and Dr. Hart and Dr. Cooper, really don't feel that looking at the genetic structure is important. It's realized that there are two parts of ApoE4. E4 is the allele that makes up that, and there are two alleles that make up the certain gene. And if you have, there are three genes, epsilon genes. There's E2, E3, and E4. And if you have two epsilon E2, you have a decreased chance of having Alzheimer's disease. If you have two ApoE3s, then you don't have any change. That's sort of considered normal. There's no increase or decrease. But if you have ApoE3 and ApoE4 that makes up your gene, then you have a 3 times greater chance of developing late onset Alzheimer's disease. And if you have two ApoE4s, you have probably between 10 and 15 times greater chance of having Alzheimer's disease. But it's not a strong correlation. If you go out and find out that your ApoE4 is ApoE4, you have two of them, you're homozygous, you think, well, you have a death sentence. No, the environmental factors that I spoke about can really overcome even bad genes that way in the late onset. Now, let me expand on that to talk about early onset Alzheimer's disease. These are patients that have Alzheimer's disease that start in their 30s, rarely, but usually in the 40s and 50s, before that, 65 years of age. And the early onset Alzheimer's disease is a different story. Those patients have a significant genetic structure and connection. So you have 3 types of genes that are part of the early onset Alzheimer's. You have APP, you have PCN1 and PCN2. And if the patient has any of those genes and develops Alzheimer's disease, then their children has a 50% chance of developing Alzheimer's disease. But everyone that has Alzheimer's disease is not early onset. So just because someone in your family has Alzheimer's disease that started in their 60s and 70s, don't worry about the PCN or the APP or the PCN2s. So there's a wonderful book written about the effect of genetic or early onset Alzheimer's disease, and it's called Still Alice. And Still Alice is just a wonderful book that goes into this genetic function and how it affected the family. And it's a wonderful book to read if any of you have not read that. Where should I go in order to know about my mineral deficiencies I may have? Well, Megan, or no, this is Tony. Tony asked this. Your physician can do that, Tony. It's some of them don't do that routinely, but any of these blood tests that can be done in any laboratory can be done, the magnesium levels, the potassium levels, the the zinc levels, the copper levels are all part of a routine function, not done routinely, but they can be ordered. So you have to speak to your doctor about ordering the appropriate type of blood tests. Tony Morgan, I feel how to cook healthy foods, affordability for families is important. You're right. Teaching healthy whole food cooking skills, budgeting at the grocery stores, and how to stretch the dollar in healthy areas of supermarkets. Yeah, so important, Tony. People just find the rapid food, getting it fast and getting back to work and eating the fast foods and the quick sugars is the easy way. And I think it's not only that they're eating the fast foods, I think the education, the knowledge base of people simply just don't know. I have nurses that work with me and they simply aren't aware of this. So the education is sorely lacking. And unfortunately, it doesn't come from the doctors. Their physicians just weren't taught about this in medical school. But you're totally right. Learning how to stretch the dollar with healthy foods can be done, but it does take knowledge and learning about that. Deidre. No, Lisa was before Deidre. Is there a special diet that you recommend? Gosh, there's not a diet. I try to really minimize sugar, and that's hard to do because just think of your dinner that you have. There's often potatoes or rice or pasta or something on it. So you really have to consciously look for foods that have a lower sugar content. So there's not a specific diet that I have, but I try to increase vegetables, increase fish, salmon 2-3 times a week, or fish 2 or 3 times a week. And remember that salmon and not some of the tuna fishes. You have to be careful about some of the fishes. Salmon is good, sardines are good, shrimps are good. But you get into the tuna fish and they have a lot of manganese in them and other potential toxins in them. Vegetables, avocados, nuts, types of nuts, especially the walnuts are very good. Types of nuts are a good way to get that protein in you. Beans, those kind of things are important. So not as specific. Is it okay to, Marilyn is asking, is it okay to eat whole grain breads and brown rice? Unfortunately, I lost her. Unfortunately, not. They sell these brown rice and the whole grains as being better. Unfortunately, they still have a lot of sugar in them, and it's not a good way. Unfortunately, but they sure market that in a great way. Decaf coffee, decaf not as good as full coffee. It doesn't have the hormetic effect that the natural coffee does have. So it's recommended that people not take the decaf, but take the whole coffee to gain the greatest hormetic effect. Girish, is it good to get tested for ApoE allele, knowing now that a lot can be done to slow progression of aging? Girish, the people that we will have in our clinic that I referred to earlier next year, the 30s and the 40-year-olds, there may be a better role to be played in those people, those that are high risk to develop. And if they have a homozygous ApoE4, there may be a role for it there as we screen these patients to find out who is high risk. Certainly people that have parents, a strong family history. In our dementia multidisciplinary clinic that we have every week, it's amazing that some of these patients come in, they said, yes, we have 5 members of the family that have Alzheimer's disease. If there's a higher frequency for that, these younger people in the 30s and 40s are more likely to get it. But I think in that place, Grace, it would be good to do it. We haven't made up a full protocol for that, but I think it would be good to do in the younger patient. When somebody's older and they've got the early stages, I'm not sure there's much value to doing that, and our people would not recommend that be done at all.
Okay, I think that is it. If we don't have any more questions, thank you so much, Dr. Shields, for joining us today. We appreciate all the wonderful information you provided.
Well, you're welcome. It's been a pleasure to talk to you and look forward to talking to you again.
Thank you.